Thank you, Orla, for the invite. Obviously, this is focusing mainly on communication, swallowing, speech difficulties, but fibromyalgia is very much it should be very much a multidisciplinary approach with everyone involved. Obviously, as a physiotherapist, our aim is to try and promote exercise and activity in people. That's very much at the level that you feel comfortable at. Okay. What am I going to talk about today? I'm going to talk about my experience of dealing with fibromyalgia. I suppose the evolution of physio management of the condition over the last 20 years or so since I qualified. The positives, the challenges involved, and the current practice where I work and what we currently do. So, how have I got here? So if someone had said to me when I qualified 19 years ago that I'd be standing there, I would have said definitely not. I just done my rheumatology clinical placement and I absolutely hated it. I think when I qualified, so I've divided it up into stages here. The dark ages, my understanding of fibromyalgia leaving college was zero, minimal, I would say. And I feel that it probably hasn't changed in 20 years, that the teaching of it and the management of it is still quite limited in students who are, and new graduates who are coming out of college now. And it can take time to build up the confidence. I think, as Ellen said, the feedback from clinicians is that they're not sure what to do. If you're coming in to see a clinician who's not sure what to do and you're not sure what the condition involves, there's not going to be a very positive outcome from that. The age of enlightenment, getting a better understanding, and I suppose as my career has evolved and as physio has evolved, a better understanding of what's involved in the condition, how we manage it, getting a better understanding of the person. Physios, we love fixing things. That's what we want to do. We want to try and fix everything that's in front of us. We can't fix, there are things that we can't fix, and that can definitely frustrate us at times. So if you've got a frustrated clinician, you've got a frustrated patient, again, it's not going to match particularly well. I suppose it's understanding that if somebody with fibromyalgia comes to see me, I'm not treating fibromyalgia, I'm treating the person who's sitting or standing in front of me. That is something I'll come to in a little while. And I suppose the digital age, with the onset of COVID, we've had to change how we were managing these patients, moving to online platforms. Not saying that that's the only option now, but I suppose it's given us more tools, more array of options for managing people. So where were we? Physio was and still is to some degree, and definitely merited in some cases very much a hands-on approach. If you come in to see a physio, you're already sore, tender all over. Physio assessing you, hands-on treatment is not going to work particularly well for you. I'm sure you've all tried it. I've definitely tried it. It hasn't worked. People get frustrated. We just end up in... I came up with this at the weekend. I'll try and explain it. If we start here, go to see your clinician. You're at that point. You're referred into physio, you're referred into occupational therapy, whoever it is you refer to, speech and language therapy if required. Hopefully you see some improvements. You move along this line. Come to here, get some improvements. Go to physio for however many sessions that is. You're making some improvements. It's not going to be a straight line. It's obviously very much a simplification. I don't have any spaghetti with me to map it out. But we get to here. What we know is over time, it's human nature, we'll start to tail off a little bit. We'll drop back a little bit. We'll stop exercising as much. We won't be quite as active as we were before. If you stop attending physios, stop attending clinicians, you don't have your appointment with a rheumatologist for another 9 months, a year, 18 months, whatever it is. Drop back a little bit. Then we regress backwards. Then in a year's time, you've got an appointment coming up with your clinician. And what people will always say is that, oh, I started to do a little bit more when I knew I had an appointment coming up with the doctor in a few weeks. I started doing a little bit more because it's human nature. We want to walk in and say, yeah, I'm doing really well. I'm doing more. I'm doing better. All that does is bring us back. Right back here. Whether it's a circle, my wife told me yesterday that a rectangle doesn't work. She made me change it to this. No, they're too straight. Those lines are too straight. But we end up back here at the start. So whether it's a circle, a rhombus, a rectangle, triangle, whatever shape you want to be, what I've seen over the years is that I'll see somebody, I'll see them for a few sessions, we make some improvements. They're back at rheumatology in a year, they're referred back into me, and they're back where they were in and around the same place where they were a year ago. How are you? I'm the same as I was the last time I saw you. That's frustrating for everyone. And we carry on in this cycle. Physio, I suppose, is evolving. It's more of a biopsychosocial approach now. So if you take all pain as a biological component, all pain as a psychological component, all pain as a social component, you have to take the three of these and try and bring them all together. So if you imagine there's three circles for biology, psychology, social, the person, where those three circles interact is where the person is. And that's where physio and health intervention should be targeted, is at the center of these circles. Whereas before we targeted, say, the biology of it, and we had some improvements possibly, but like I said, every pain has a psychological component. If you go and twist your ankle, there's a psychological component to that pain. How does that affect you? If I go and twist my ankle, I'm like, oh, my ankle will probably be fine in a few days. If I twist my ankle, I've twisted my ankle multiple times before. I've had 2 surgeries on that ankle. It's like, it's the exact same injury for me as someone else, but the psychology of it is completely different. Same as a social approach. So how does that affect somebody? So if I go out and injure my knee, I'm not particularly sporty, I cycle in and out to work, I need to get back cycling. Is it a person in their 80s who is living at home alone, has stairs, needs to be able to get up and down? That knee injury is going to affect them much more. With fibromyalgia, we need to be able to combine all these approaches, and obviously taking into consideration everything that's going on in that person's life. So as we talked about, listening to the person's story is the most important thing that any health professional can do in the initial stages. Doing our best to understand that story as best we can. We may or may not succeed at it, but we try to do our best. But as I said, it's putting the person at the center. I'm trying not to use the word patient. I don't like using the word patient. I find it's very much medicalized, and it's making you seem sick. Put the person at the center. How can we make it a more positive approach? When I spoke to Orla about what she wanted me to talk about, Orla definitely mentioned the words positives, the positives of treating fibromyalgia, the negatives of treating fibromyalgia. I changed it to challenges rather than negatives. I was doing up these lists yesterday. This slide was positives on one side, challenges on the other. And I suppose I thought about it and thinking about the psychology of pain, how can we change it? I changed the title to positive challenges. So just trying to reframe how we think about it. Can we make these challenges into positives? What positive spin can we put on them? I suppose we know that over 90% of people's thoughts are the same thoughts every day. If these thoughts are negative thoughts, we're constantly in that negative cycle. Can we change it to positive? So as I've said, from my point of view, what I try and do is on a first session, get an understanding of where the patient is coming from, where they are at the minute, what it is that they want to achieve. With fibromyalgia, obviously, there's a huge variety of symptoms that people are going to report. There will be a variety in symptoms if they come to me today and see me again in 2-3 weeks' time. They can be feeling completely different. Getting the engagement in the short term, generally not an issue. As with any exercise activity program, medium, long-term engagement, much more difficult to achieve. And that's human nature. How can we improve that? How can we change that? The complexity of fibromyalgia is certainly a challenge. It's something that I've come to enjoy. I don't want to be treating ankle sprains all day. I'll go absolutely mental. Definitely a challenge is the uncertainty. As I said, I could see somebody today, start them on a program, they get started, they come back in 2 weeks. Oh yeah, that's actually helping. I'm feeling a little bit better, knowing that they can come back in 2-3 weeks. They could turn around and say that afternoon I had a flare up and I felt much worse afterwards. There is that uncertainty, and that is a challenge. And then again, as I said about engagement and maintaining, is trying to maintain that level. As I spoke about before, what we tend is when you're discharged from physio, you tend to drop off a little bit. And that's human nature. How can we give people the tools to maintain those levels? So I suppose the important things are finding out what people are interested in. So as we talked about, whether it's walking, running, cycling, swimming, any exercise is better than none. If you do 2 minutes of exercise today, it's better than doing no minutes of exercise. So all health professionals, physios, whoever it is that you're seeing, should sit down with you and set agreed goals with you on what you want to be able to achieve, rather than me saying, well, these are the guidelines, this is what you need to be able to do. If you're not able to do that, if I tell you to go out and walk for 30 minutes a day, and you're currently able to do 5 minutes, you're not going to do it. Rightly so, why should you? If you can start at an agreed level and build up from there, and try and gradually improve, that's what we're looking for. There will be times you're not able to do as much, but it's focusing on the positives. If you're able to do something in the day, rather than, well, this is what the physio asked me to do, I wasn't able to do it, focus on, well, this is what I was actually able to do today. So where I work in St. James's Hospital, so what do we currently do? And I was just sitting over there this morning and I realised that some of the other resources I have on here are represented at the back, and some that are represented are not on this slide, and I apologise. So what do we currently do? So we currently have a fibromyalgia exercise class which runs once a week for 2 months. So generally 8 to 9 sessions, face-to-face appointments. We have education sessions and exercise classes, 2 physios involved, generally 8 to 10 patients. Referred in from rheumatology. Everyone is assessed on a one-to-one basis and started on an individual exercise program before they come to us. We also have an online exercise class. Obviously, it can be difficult for people traveling to and from hospital appointments. So we have an exercise class on a Friday morning on Zoom. If anyone is interested in attending, you just need to have a James's Hospital number. If you have one, just send me an email. We can get you in. Definitely it works best with dual approach. Some people prefer face-to-face, some people prefer online. But I think it's about making these options available for people. I know the options are available with Arthritis Ireland, with Fibro Ireland, with Chronic Pain Ireland. There are these self-management programs, and I suppose our programs are based along very similar lines. That website there on the bottom, livewellwithpain.co.uk, is set up by a person who lives with chronic pain. There's a clinician section, there's a patient section. It's similar to what Dr. Chadwick was talking about earlier. There is a section, there's 10 different steps on it about pacing, sleep, diet, managing flare-ups. All the different sections are there. Is written by patients for patients. The Footsteps Festival is linked to that as well. So there are lots of different activities. There are talks, information sessions. There are exercise classes on it, cookery classes, book clubs. I suppose, one of the big reasons we set up our class is to try and obviously change that cycle that people are in. Really, one of the big things we want to try and promote is that peer support among people with fibromyalgia. That if, as has been said already, the real experts on fibromyalgia are the people who live with it every day. I've learned more. I'd say I've learned more from my patients than my patients have learned from me. But it's trying to create that network for people, that they have that support around them. Then just a final thought. I was at the Van Gogh exhibition in the RDS last Friday, and which is well worth a visit, but this this was mentioned as there was a different section at the end. This quote came up. So, does life change if we change the way we view life? So, this is a difficult thing to do, but if how we view life, so rather than, as I said, rather than focusing on, well, I wasn't able to do this today, if we try and focus on what we can do and what we've been able to achieve, even writing it down at the end of the day, 3 positive thoughts, what did I achieve today, what went well today, will that change? It's a difficult process and it will take time, but we do know the positive thoughts lead to positive changes. Okay, thank you.